Bottom line, you had 3 U.S. senators, 2 of them Democrats, the 2 Democrats you could see, not keen on any Republican plan on this, but open to some changes as long as they don't repeal Obamacare. That is not going to happen if Republicans continue controlling things. Yet even one of those Republicans saying that, it's not going to happen with him. In other words, he is not keen on what the House has done. Rand Paul echoing the view of a couple of other numbers crunchers, Republican senators who are not keen on this measure. That doesn't mean that they can't be made keen, that some of the changes that they're advocating can't be passed, and then in conference they can settle their differences. But let's iron this out with the Daily Caller News Foundation editor-in-chief Chris Bedford and the Independent Women Forum's Gayle Trotter. So Gayle, to you on this and whether those gaps can be overcome. I was surprised that they were as significant as they were among Republicans. And dramatically so between Republican senators and Republican representatives. What do you think?
Right. Well, the Republicans are split on this. There are all these solutions to try to unleash innovation and free market when it comes to health care so that patients can have more choice. It can be a more doctor-centered medical experience. And unfortunately, there are different approaches of how to do this. But what the House has passed is an important first step. And now we're going to have to see if the Senate takes the ball and runs with it, or if we have this crushing misinformation campaign that's coming from opponents of trying to reform, repeal, replace Obamacare.
Chris, the role of the president in this, what do you think? I mean, obviously he was much more intimately involved this second go-round on this health care rework than he was in the first. And he knew the names of those who were on the fence. And in fact, if you believe some of the congressmen speaking yesterday at the White House, he would spell them out and say, this is someone you should call, this is someone you should call. Would he work the same in the Senate?
I think so. Trump took a very active role on this, and the word is, and everyone I've talked to says this is true, Paul Ryan, a lot of House leadership was really kind of pushed out of the last deal that they passed, and Mike Pence took the lead. He helped with the amendments. He helped get it across. And then some people commented that yesterday's Rose Garden was a bit of a premature celebration. But more than that, it was pressure from President Trump to the Republicans in the Senate. They say, this bill will not die in your House. You have to pass this. And the Republicans in the Senate also have a slightly easier job, actually, than the House. They can move it around, but they don't have Republican senators from New York. They don't have them from Illinois, from California. They don't have these constituencies, just Toomey in Pennsylvania. So they'll be able to put something together, and I think you'll see changes, but the larger contours of the House bill will probably make it through.
That's very interesting, because you're right. I mean, they also have the liberty of just adding stuff up like a Christmas tree here, so that could complicate their efforts. But, Chris mentioned something interesting, Gayle, on how this was portrayed. Did the administration overplay it? Certainly that was the read when I got off the air yesterday on Fox News, watching the reaction to this and the media collectively saying, oh, he's whooping it up, just getting approval out of one chamber. But the same media was going after the president for failing in that same chamber to even get a bill introduced for a vote. So he can't win. But what do you make of that he did this deliberately, not as much to put pressure on Republican senators as to remind the media, 40 days ago you said I was a failure, and I helped deliver the goods this go around?
That's exactly right. The mainstream media is trying to treat this as heads I win, tails you lose.
Absolutely.
And President Trump is having none of that. They are the opposition party, and he is reminding them that he can get victories, he can get stuff passed through the House. And it's very exciting for conservatives and Republicans to see that there's some motion in the Congress now. It might not be the perfect be-all, end-all solution to our health care problems, but it's a first step that would not have happened without President Trump in the Oval Office.
That's a sign, Chris, that we're going to see a lot more of him in future efforts. He will say that because he did get intimately involved here, and he did, that's going to be what he's going to do.
Yeah, and he loves being him. He sold himself as deal maker in chief, and he's brought a lot of the ideas that he had when he was working in real estate to the White House. He found that some of those didn't work. He found that when you're competing with people in real estate, your enemy is not going to really try to burn you to the ground quite to the same level that a lot of your political opponents will. I think yesterday might have been the first time a lot of major newspapers said that actions by Donald Trump were going to kill Americans. So it's a new kind of bargaining like in his book, Art of the Deal, he actually talks about not really loving to do business with the Japanese because it's never a one-on-one deal. The business groups roll in big groups. Now he's got a much bigger group than 6 Japanese businessmen. He's got the whole U.S. Congress, and I think the Senate with its smaller numbers will definitely be something he's happy to deal with, and he's going to dive in.
Yeah, you're right, though. You never hear a developer say you're going to kill people if you get this project. Chris, thank you very, very much. Gayle, same to you. I appreciate it.